I want us to take a moment and talk about an element of medicine that we often overlook, and that element is trust. Most specifically, I'm referring to the trust that exists between the patient and the physician who is caring for them. Now, in the sea of things that we have to do in the clinical setting, it may be very easy to overlook the fact that maybe the patient doesn't trust us. Maybe they don't trust the medical input that we are giving them. Let's take an example here of a child who has hit their head and now is in the ED for evaluation. Now, with a pediatric case like this, with a little bit of head trauma, that's just trauma, that's not blood. One of the first things that we have to decide, one of the big decisions that we have to make clinically, is whether or not this child is going to get a CT scan of the head. This is a big bifurcation for us because it kind of changes what happens next, depending on, of course, if there are findings or if there are not. But really, the concept of deciding whether or not to get this CT scan is comparatively a big decision, because if we don't scan a child who, let's say, has a bleed in their head inside the cranium, then we'll miss it. And maybe that child will have some morbidity or mortality that could have been avoided with getting the scan. If we scan a child who doesn't need one, we're going to be giving them a lot of radiation from the CT scan. And after you scan enough children and give them that radiation, we start to think about if we're increasing the risk of children developing cancer later on in life. So it's not a decision to take lightly, and there are a lot of clinical considerations that go into that choice. Now, let's say we're in this setting where we are trying to decide that if a child needs a CT scan or not. And the parent is also making that decision, and the parent has already decided that they would like a CT scan. If we evaluate the child and see no indication, either through the history or the physical exam, that the child actually would benefit from getting the scan, essentially, if we, based upon our assessment, think that the chance that the child has any type of serious brain injury is so low that the risks of the scan really outweigh its benefit, that is the message that we have to get across to the patient and the patient's parent. In this case, let's say the parent doesn't agree with you. We really have to evaluate, why is it that a patient would disagree with the opinion of a doctor? And I think we can make a really strong case here that more often than not, an element of distrust circulates that discrepancy between the patient's opinion and the doctor's. Because if the patient fundamentally trusts your clinical judgment, they will agree with your clinical decision. That's pretty much intrinsic to the concept of trust. However, if they don't, this is where we get into problems where there's a legitimate disagreement between either the patient or their family members and the doctor. In thinking about problem solving, when we have a situation like this, we have to evaluate, why is it that the patient or the patient's parent in this case doesn't trust the physician? And I think, again, there are always exceptions, but fundamentally there has to be some element where the patient does not believe that the physician has the best interest of the child in mind. And we really have to think about why this is the case. Is there a way that, as a physician, we can make it clear what our clinical reasoning is? And obviously, from our standpoint, we would only not recommend the CT if we thought it was in the best interest of the patient. Our goals are aligned. So it's very, very important, and we can see here with this case in front of us that we have to do everything we can to make it clear that our clinical judgment is trustworthy, and we have to earn the trust of the patients that we're seeing.